One telltale symptoms that is quite common in patients who have got iron deficiency anemia is we can divide the symptoms of patients presenting with iron deficiency anemia to number one, the common symptoms, and number two, less common symptoms but very important ones. Now, the most common symptoms that patients tend to present to us basically are having lightheadedness, frequent headaches, and also giddiness, very generalized lethargy and tiredness, as well as shortness of breath, palpitations, especially on exertion, when climbing on stairs or doing more strenuous activities. When the anemia becomes more apparent, some of these patients tend to complain of chest discomfort and sometimes having frequent fainting episodes. Now, less common symptoms that patient can present with an underlying iron deficiency anemia, which are usually not picked up, are, for example, number one, frequent hair loss. Number two, brittle nails. Number three, brain fog, where patients tend to have poor concentration, especially we notice that students in school, universities, where they're unable to concentrate or focus during studies, and also patients who are unable to concentrate at workplace. Other symptoms that we tend to also pick up is what we call as restless leg syndrome, where they tend to have difficulty sleeping at night, where they tend to have restlessness when going to bed. At the same time, they have muscle cramps as well. And one telltale symptoms that is quite common in patients who have got iron deficiency anemia is what we call as Pica. Basically, this group of patients having a craving to eat unusual substances. For example, chewing on ice, soil, paper, and also other substances. And they can't help themselves from having this craving of eating or consuming these unusual substances. So if you have, or anyone who have got these unusual cravings, it's good to get it checked early to basically rule out if the person has got iron deficiency anemia.